Good. How are you?
I'm fine. How are you?
Yeah, very good.
Good. Good to see you all.
People join us and then we'll make a start. More. We like your background.
Hi, Karen.
Hi, everybody. I've seen a few waves. It's lovely to meet you all.
Hi, everyone.
Thanks for joining today, Karen.
My pleasure, honestly.
Right. Welcome all to our celebration of South Asian Heritage Month. So welcome everybody and hope you're looking forward to today's event. We would like to just say Eid Mubarak, belated Eid Mubarak to all our staff who celebrated last week. So Eid Mubarak all. So, as you all know, just housekeeping, I'm sure you are all familiar with MS Teams. For those that just needed a reminder, please mute yourself if you're not talking so the event can go as smoothly as possible. If you'd like to contribute to the discussions, please raise your hand or use the chat function. The other thing to note is the event is being recorded for those that are not able to be with us today. So just to note that. So without no further ado, I would like to introduce our facilitators for today, Sangeeta and Ragrish. So welcome and thank you so much for your input in organising today. And I know it's going to be a phenomenal time that we're going to have. So thank you so much for putting it all together and welcome.
Thanks so much, and thanks so much to the BME network for hosting this again, as we did last year. My name's Ragishri. I'm one of the HIV consultants based at the Royal London, and I'm going to be co-hosting this with Sangeeta. Sangeeta, do you want to introduce yourself?
Hi, everybody. And I'm Sangeeta. I'm a systems specialist. I work in the doctors revalidation team. And thank you to the BME network and all the hosts who've joined in, host speakers who've joined in today.
So today, as you know, we're celebrating South Asian Heritage Month, and we've got some really fantastic speakers for you. And we hope there'll also be time to have a Q&A and a bit of a discussion afterwards, aware that we only have an hour, and I think we could do this for all morning, to be honest. So I'm just going to briefly talk to you a little bit about what South Asian Heritage Month is and what it aims to do. So it's the month that runs from the 18th of July to the 17th of August every year, and it seeks to raise the profile of British South Asian heritage and history in the UK through education, arts, culture and commemoration. And its goal is to help people better understand the diversity of present-day Britain and improve social cohesion across the country. And it started last year, and we celebrated it last year here as well. So it's really about people reclaiming their history and identity and letting people tell their own stories. And its aims this year, it has 3 aims. They are to celebrate, which I feel we are doing today. It also aims to commemorate, and I think that's a really important thing, particularly again with the COVID pandemic. We know that many of our staff, our patients and the local population have been significantly affected by COVID. So it's nice to commemorate those who have been affected. And we know from our own Barts Health admission data that Asians in our local population have been particularly affected both in the first and second wave. And the third aim of South Asian Heritage Month is to educate, and I think we're going to have some of that in here as well. So I'm going to move on, and I'm going to introduce the first of our speakers. So our first speaker is Romina Toki, and who joins us from Elft. And she is a British Bangladeshi Muslim clinical psychologist. She's currently working in the Tower Hamlets Community Psychology and Engagement team, and she's also a project manager at Central London Youth Development, which is a voluntary sector organisation. She's been dedicated to being part of a team that's been collecting and preserving the stories of elders in the British Bangladeshi community. And at this event, she'll discuss the impact of this work for her local community. So absolutely going with the South Asian Heritage Month themes about collecting stories. So Romina, I will pass over to you.
Thank you so much. I'm gonna pray that the right window pops up when I share screen. Can you guys all see that? Is that okay?
We can see your name. Yeah, we can see it. Yeah.
You can see it?
Yeah.
Okay, fab. So thank you so much for inviting me to this event. It's always such an honor for me to talk about this work. I think when people think of clinical psychologists, they often imagine us being in a room one-to-one, doing some of that individual therapy, or you might see trainee psychologists running around collecting data, trying to get their thesis done. But I personally think, you know, the role of a psychologist is so broad, and the work that I think has had the most impact in my community has been the work that I've been able to do through the voluntary sector, the charity sector. So I'm really looking forward to talking to you guys very quickly about one of the projects that I was involved in. I think you know, at the center of this work, it's holding equality. It's holding equality in mind. It's holding liberation in mind. And that's what we do at Central London Youth Development. It's about not working with just the individual and thinking about mental health as being an individual problem, and it's thinking about the systems that are involved, and it's thinking about things like education, like arts, physical health, relational health, the community, as well as thinking about the individual. So one of the projects that has been my most favorite project has been the social action research that we've been involved in. I've only got 10 minutes, so I'm not going to go into defining what social action research is. But what I always say, that it's work that is value driven. It's about thinking about doing research from a community grassroots kind of approach to the research. So it's about the community being involved in collecting the research, conducting the research, and then disseminating the research. It's about research that liberates us. It's about changing the narratives that we might hear about our communities. So when we started some of our projects, we really thought about what is it that is told about our heritage, about us being Bangladeshi. Some of those stories were about us being on benefits and stealing from the system, or us being women being oppressed, women, families not integrating into mainstream society, us not really contributing to British society, etc., etc. And when we thought about those stories, we thought actually they made us feel a sense of shame about our Bangladeshi history and our Bangladeshi identity. It made us feel oppressed. It made us, want to hide that and just conform and assimilate to the mainstream. So we thought, actually, how can we reclaim some of these stories? So what we thought is, actually, there's so much in our history that has never been recorded. British Bangladeshi history, we've been here since the 60s and 70s, but none of that has been collected. And what we had was that we had access to our grandparents, who were the first generation to come to this country. So they had all of that knowledge of the independence of Bangladesh, which only happened in the 70s. And they also had the experience of settling here in Britain. So it was really a key part of our British Bangladeshi identity that was at risk of being lost. And so we thought, actually, we need to go and collect that. So we did. We collected loads of those stories, and we self-published 2 history books, which I'm very, very proud of. So one of them is The Legacy of Women's Contribution in 1971. We noticed that when it came to thinking about Bangladeshi independence, a lot of those stories were centered around the roles of men. We were obviously livid because women are often the ones that are forgotten. So we knew that, our aunties in the community were involved in this, in the liberation of Bangladesh, but that had never been collected. So we went around London and Birmingham, and we interviewed the ladies that were involved in Bangladeshi independence, and we heard about their stories of activism and raising public awareness and fundraising and balancing their duties as mothers, as carers, and working, and how they really fought for the independence of Bangladesh. Faces in Westminster was collecting the stories of those first generation Bangladeshis who migrated over here. So we interviewed our grandparents, and we heard about the ways that they fought so hard to preserve their heritage and also carve out their place in society here, and all the sophisticated ways that they integrated into society. So some of the conversations that we had, I'm not going to read out all of them, so I'll just pick like 1 or 2. So Ustar Ali is actually my granddad, and I got to interview him. And this is one of my favorite quotes. And he says, "The way of life was different in this country. Traveling from one city to another was a real struggle. We were illiterate and did not understand this culture. A lot of us did not know how to read numbers. So what we used to do was put bricks in front of our homes to signal our location. My friends didn't know what 8 was. So I told him, put 2 eggs on top of each other." It was such an honor to be able to interview him and to retell his story to other British Bangladeshis. Yeah, I've got a few pages of the quotes. I won't read all of them. I'm sorry, I don't have time, but I'm happy to share the slides. I especially like this one in the middle. The biggest obstacle was that my children were adopting a British culture where they kept speaking in English and losing their Bengali culture. I supported their studies, but ensured that at home they only spoke Bengali and were not allowed to speak English, so they would not forget. And really, we had so many stories of these parents really wanting their children to integrate and really wanting their children to be educated and build a life for themselves here, but at the same time, really not wanting them to lose this culture that they fought so hard for only a few years before. So yeah, I think we really collected some of those really most treasured memories from people, and we were so grateful for that. So I guess, thinking about the outcomes of this work, on a personal level, we as the researchers from within the community felt so liberated. On a relational level, we felt like we had a sense of belonging and a sense of pride towards our community and that part of our identity, where before we felt shame and felt invisible, in mainstream history, we now felt like we had a story, and it was one that we could now reference and share. We felt such a sense of pride towards our elders. That relationship had been so strengthened. We had learned about what kind of questions to ask, and were able to use some of those lessons in our daily lives. So yeah, I'm very grateful for this work, and I'm very sorry I couldn't share more of it, but these publications are available online. So yeah, get in touch if you are interested to hear any more. Thank you, that's me.
Thank you so much, Romina. I could have listened to you talk more about your project, I think, for much, much longer. And I'd be really grateful if you could put in the chat perhaps the links to your books. I'm sure people would want to read them. So I certainly would like to. And it sounds like really incredible work. I just think, the process of recording histories is so important. I always think I must sit down with my parents and just get them to talk at me, which is normally not the most enjoyable thing, but I actually really want to hear their stories before they go.
Yeah, and we did that for my granddad. I think from this really influenced us to all of us grandchildren. There's about 20 of us. All of us collected stories of my granddad and we put it into a little book for our family. So I think it's so possible, like these things are so possible. So yeah.
Thank you so much. So there'll be an opportunity in the Q&A for other people to ask you questions. I'm going to move on to the next speaker. So I'm really excited that the next speaker is Ami Banerjee. So he is a professor of clinical data science at UCL and a consultant cardiologist here and at UCL. He's a researcher, educator and clinician with interests spanning data science, cardiovascular disease, global health, training and evidence-based healthcare, and he's been active clinically and academically throughout the pandemic. So I'm really excited that he's here today, and Ami, I'll pass over to you.
Thank you so much, Rageshri and Sangeeta, for organising and inviting me. And thanks, Romina. I really enjoyed your talk. I'm just going to try and bring up my slides. So I've indulged myself a bit in that Rageshri gave quite a broad remit that we could talk about our roots, our career, our South Asian influences. So my title is From Howrah to Hull to High Barnet. And I grew up in Hull. I'm born and brought up in East Yorkshire. And this is me, age 11. And in a year of 120 kids at school, there were 3 of us who were non-white, and that summarizes really that Hull was not very ethnically diverse when I was growing up, and there wasn't a big South Asian community. There wasn't a big ethnic minority community in Hull, and in fact there were probably 4 or 5 Bengali families, and both Bangladeshi and Indian Bengali, and we both identified as Bengali. So it was a new thing to me coming to London, where Bengali tended to be more Bangladeshi, how people describe. And so after school in Hull, I did my medical school in Oxford, and then worked around Oxford, Newcastle, Hull, and then did a stint in London before going to America for a year, where I did a master's in public health at Harvard, and that's where I got interested in the more public health side of cardiovascular disease, and started doing some research in the Indian subcontinent, and became more aware of the predisposition of certain communities to risk factors for heart disease and heart disease itself. And then I came back, did my MRCP, my cardiology training in Birmingham, and I always remember there that I was doing an on-call there as a registrar in cardiology, and I said I was Dr. Banerjee, and the switchboard operator said, "Which one?" And that's a question I'd never faced in Hull or Newcastle, and that tells you the difference in the makeup of the population. And I then went, then I came to UCL and Barts in 2015, and my clinical role in the Barts Trust is I'm a heart failure consultant at the Royal London Hospital, and of course it wouldn't be right not to mention COVID this year. So I've, like many of you on the call, been involved clinically, and this was before a nursing shift in intensive care during the second wave, where I'll also be touching that a bit later, how the South Asian influence was kind of very much in my mind, both as a researcher and as a clinician, because of who I was seeing throughout the last year and a half. So these are my main mentors, my parents. My dad on the right. This is us taking the Tebet test at Lord's, watching India versus England, and so he is from Howrah, which is a district just outside of Calcutta in West Bengal, and he came in 1972. And his first job was in Stockport, and he moved around wherever the jobs were, and ended up doing general practice in Hull. And then my mother came over from Delhi, which is where she's originally from. Her father worked in the railways and had moved from Kolkata to Delhi, and she's a maths teacher. And we had, I can say we weren't wanting for anything growing up, but we didn't have a big community. But the way they supplemented the South Asian or Indian part of our heritage really was by having every year our holiday was to go back to India to see family. And just to remind people that Kolkata is up in the northeast, Delhi is up towards the north, and later on my mum's side of the family moved to Mumbai, so I became more familiar with Mumbai. And because there wasn't a big community, my parents had a network of friends around the country who we'd go and visit, and we'd take every opportunity to get dressed up in our traditional Indian dress. And so this is me and my two brothers on the left, and on the right here is Howrah, where my dad's side of the family is, and he's from a family of 5 brothers and 2 sisters, and these are all of us cousins in our generation, several years back now. But it was a big open plan house, which when I was preparing for this talk, I found something I'd painted during medical school, which just captures how green and lush that area of India is. Lots of palm trees, mangoes, and every exotic fruit you can think of, and large flat roofs where my summers were spent. And so I had this gap between what I was experiencing in the summers in my South Asian experience growing up in Hull. This is my wife, who's from Mumbai originally, and she moved with me here in 2010, and we, since moving to London, we're quite involved in the local, both with Indian and Bengali cultural activities. This is Durga Puja on the left, which is a big Hindu Bengali festival every year. This is in Camden. On the right is at the Watford Temple with my now 7-year-old daughter, who is a singer and a dancer in Indian traditional form, you know, far more talented than her dad. And I just wanted to touch on the fact that I've been really lucky to be able to carry my work research-wise on in India. So I'm an epidemiologist by training. I look at patterns of disease, and I have contacts in Trivandrum and Kochi in Kerala, and now have a visiting position there. So over the last 10 years, we've been doing a large population or community-based study of non-communicable disease and working with non-physician health workers there, and that's been really really a great privilege to have a longer-term piece of work where we can really work with the local communities. Now, from there, I wanted to just briefly talk about the experience of COVID in South Asians. The first data, I believe this is the first tweet that was sent by my friend Kamlesh Kunti from Leicester to suggest that there was an increased mortality risk in ethnic minority people from coronavirus. And that was from the ITU data that was being published nationally, and they subsequently published an editorial about this in the British Medical Journal. And I'd just like to mention this issue of ethnic minority and South Asians in coronary disease with respect to the learning health system. So this is a framework where usually these three circles, science or research, the evidence, which is clinical guidelines, and the care that we provide, are three often separate silos, but actually we want them to all be working together. And so that if you take the first of those, evidence, there have been several reports. This is from Office of National Statistics, Public Health England, the South Asian Health Foundation, where I'm a trustee. We published a couple of reports about this. It was quite apparent that there was an excess of mortality and risk in ethnic minorities, particularly South Asians, both in terms of risk of infection and mortality. But we need to know more in terms of the risk of indirect effects, non-COVID deaths. We need to know more about the longer-term effects of coronavirus, long COVID. And we need still more about the actual barriers and facilitators to healthcare access, both in and outside the COVID context. In terms of science, there's probably been never as much ethnicity-related research quickly being done using real-time data and informing policy. This is from a South Asian Health Foundation report on everything from lifestyle and past medical history, and there have been several papers that have reviewed this, but we know that there are inequalities by ethnicity with coronavirus, and it's mostly unmasking perhaps pre-existing inequalities. They can be biological, structural, or behavioural. but people have tended to focus on the things that might be biologic, but actually the structural things are the harder things to tackle. And ethnicity intersects with many other inequalities, be it by socioeconomic status, education, and so on. Finally, in terms of care, this has led to the risk assessment. I remember when I went to work briefly at the Nightingale Hospital. This constituted just being asked whether I was hypertensive or diabetic. Of course, that's formalised now as part of all of our risk assessment in the workplace. Vaccination, we need to make sure within particularly ethnic minority communities that we pay more attention to keeping infection rate down, particularly as things have opened up, and that involves information, education, awareness. And beyond the pandemic, how we can learn from this and make sure that we have true kind of healthcare equity for all is a real challenge. So I think, as well as telling you a bit about myself, I want to say that I think the pace of reports showing these health inequities has been unprecedented, and the pace of the analysis of the data has been unprecedented. But still, the pace of the system change is not as much as we would like to have seen, and that is because some of those things are pre-existing of COVID and have been there for a long time, beyond the health sector. So I'll just finish with some quotes that, even though I look at data and epidemiology, of course, there are people and patients behind every single data point, and happy to take questions. Thank you.
Thank you, Ami. Thank you so much for sharing those beautiful pictures and painting. And without further delay, I'll introduce the next guest, who's Karen Chuman. She's the head of talent NHS London, and she's also a trained coach, mentor, and action learning set facilitator. And she has a huge passion for talent management and investing in people to fulfill their potential. During the recent COVID first wave, Karen has established the London Deployment Hub, deploying workforce to the London Nightingale Trust and London Nightingale Trust. And before joining the NHS, she was with the Forensic Science Service. And Karen has also worked at local and national levels, and as well as in partnership with the 4 UK nations. Without more delay, I will ask Karen to take over and share her slides, please, if she can.
Thank you very much. And now you're going to see me struggle with tech as I try to pull my slides up. Bear with me 1 second. So hopefully you can all see that. Yes. Fantastic. Okay, so thank you very much for having me. My name is Karen, and I am absolutely passionate about people and talent. And I really think that comes actually from my South Asian heritage. So the only reason that I am here at the moment is because my parents came over. My parents came over in the 70s to train as nurses. And my mum on the left was first generation. So her father moved from India to Malaysia. And my dad was first generation Mauritian from India to Mauritius. And they came over here to study, and they met, they fell in love, and they had me, and I was first generation British. And what I absolutely love about this picture is matron, if we can remember matron, and the principal lecturer and the assistant lecturer. So that was what the world of the NHS looked like to my parents when they came over in the 70s. My dad hiding away in the background. You'll see that I have inherited his eyebrows. They are delightful, typical Asian eyebrows. And I really only went back to both of those places very periodically because it was really expensive. And I remember stories from my parents around, you know, you couldn't get noodles to make, you know, Malay chow mein, you had to use pasta. It was really hard to get spices. But I remember really loving it because there were huge families back home, and in the UK it was just us, and it was so tiny. And I remember going back and thinking I never wanted to come back to the UK because I loved my family abroad. And as one of the youngest, I was absolutely spoiled. So you could see me sitting there on my uncle's motorbike and my other aunt in Mauritius teaching me how to make chapatis. And I thought, oh, why would I? Cold. England's cold. Why did we come here? Really absolutely loved it, and we didn't get back often enough. And growing up, I had the typical Asian experience. I think one of the speakers spoke about their child learning national dance. I learned national dance. And it was a love and hate relationship because while I was doing this, all my friends were going to trampolining or brownies or learning to knit. And I was going to South Asian dance and I didn't really understand what that was. And it was a little bit embarrassing, but it so shaped who I was. In terms of combating my shyness and ensuring that I was proud of my heritage. And the other part of my growing up, and many of you will have heard this from your parents, sciences. You must study the sciences. And I remember in horror when I came back to speak to my parents, I said, you know, I think I'd quite like to do a music A-level. And I got, no, you're doing maths and sciences. So that led to my career in forensics, which I absolutely loved. But strangely, forensics and science led me to my love of people because that's where I became a line manager, and I started to really understand what talent was, understanding people's skills and their capabilities and how that matched to the work that they were doing. But as with everything, all good things come to an end. And the organisation I worked for was a government department. And after investing a huge amount of money in us, they closed us down. And so in the top right-hand corner is my desk, which is luxurious by NHS standards. I recognise that. But I kept that picture because if anyone remembers clear desk policy, this is the one and only time in my life I have met the clear desk policy, when I was actually forced to throw everything in the bin because we were closing down. And the bottom was the very first lab that I worked in. But as that door closed, what actually happened was another opened and I joined the NHS. And it was the first time I was given the opportunity to build a team, to build my own team that worked in business support. We did all the planning, we managed all the money, we did all the people recruitment. And I have to say, this was just not my team, this was our team. And I think it's the most diverse team I've ever worked in. And that's because people wanted to join the team because we built a culture that people really enjoyed. And it was a culture that everyone could engage in and be part of, whatever your background, whatever your ethnicity, whatever your likes and dislikes. And that's because we were pretty open. We communicated really well together. But again, in the NHS, we love a change. And so there was a merger, the team was broken up, and we all moved on. But beautifully, we actually do keep in contact. So that to me is the sign of a really great team, when you move on and you still have connection with people. And so my heritage taught me, and my parents taught me, whatever you do, do it to your best because you can't go wrong. Believe in yourself and strive forward. Know your worth, because if you know your worth, then you can combat anything that the world throws at you. And be on the lookout for opportunities. And if you can't find one, make one. Make some friends. Join a network. Get online. And then if the opportunity is not coming to you, you'll create one for yourself. And don't forget, be kind along the way. Many people think that success is getting from one place to the other in a straight line, and it's never that way. It's definitely the bottom one. You're going to have some challenges, you're going to meet some people along the way who will piggyback you, and you'll meet someone now and one day they might be really important in your future and you might be really important in their future. So that's why kindness is so important. And that's me. So I guess it's really any questions from you guys.
Thanks, Karen. There is a chat facility, so if anybody wants to leave any comment or wants to share their views by listening to the stories which we are listening today, please feel free to put the comments on chat. And Rageshri, shall we just go to Raj next?
No, I have a question actually, if that's okay. I wanted to ask Romina, were there any stories that surprised you from what you heard?
I could not resonate more with maths and science. My parents were so mortified when I said I wanted to do art. Media studies was the compromise. It was like, fine, that's it. No art. You're not allowed art. What do you mean art? You can't be successful in this country with art. It's beautiful. Thank you so much.
You're on mute. You've gone back on mute, Raghamesh.
I think my computer's just lagging
Again.
behind a bit.
Try again.
Can you hear me now?
Monica, do you want?
Hello.
Yeah. Yeah, we can. Go ahead.
Karen, you're.
Yeah, we can hear you. Go.
I am not on mute. Hello, can you hear me?
Yes.
Yeah, we can. Go ahead.
Karen, thank you for your lovely story. It made me laugh because your background is not dissimilar from my own and many people of Caribbean heritage. And just like Romina, our parents are very much into science, and you just had to have an ology, or else you're not there. You're not there. Yeah, no arts. What is that? I totally agree. But yeah, it's really good. And I don't know if you have your own family, but would you pass on that same upbringing to your own?
Yeah, I think I would. So I remember at the time when I'd been going to majorettes and my mum suddenly said, no, you're going to South Indian dance. I was like, but I've got a twirly baton. Why do I want to wear a sari? I really didn't like it. But looking back, I'm so grateful to it because it just kept me in connection. And like Romina said about, some of the families have said, you speak your language at home, you speak English outside. I think if my parents hadn't have done that, I would really have become detrimented because I'd have lost out something so important. And Romina, as Romina said, stories are so important because my mum, she's the first girl in her family to go to school, and she fought the whole family to do that. They wanted her to get married and stay. And she said, no. She said that she went to a convent school in Malaysia because in that time it was Malaya and it was occupied. And she remembers running to the local holy man saying, they're going to take me out of school. And he had to come to the family and talk to them. And it's things like that information which makes me remember how privileged I am and makes me want to help other people who are not as lucky as I am. And so I think it's really has shaped my my kindness, and I'd want my children to have that too.
can I just say also, I appreciate your description of your workplace and being a family in a multicultural department, and I experienced that as well, and we were really close with everybody and went to weddings, and we went to one of my fondest memories is going to a South Asian wedding where our colleague actually had us all dressed in saris, and it was just really beautiful. It was one of the best experiences ever. So yeah.
Could I ask Amy a question? I just wanted to know a bit more about your work with the South Asian Health Foundation. Could you tell us a bit?
Thanks, Ragashri. When I was a registrar, a cardiology trainee in the West Midlands, I worked with a consultant called Kiran Patel, who, when he was a trainee, had set this up, and I think it's now in its 22nd year since it was set up. But at that time, it was well recognised that there was a higher rate of heart attacks in South Asians, but also there seemed to be less access to healthcare, so you were less likely to have an angiogram if you were of South Asian heritage. That was the case when I was at medical school in the mid to late 90s, and so the South Asian Health Foundation was trying to raise awareness and advocacy around health inequalities around ethnicity, and it started out, and it's still kind of named South Asian, but actually it's become much more and now BAME has become the wrong term, but around ethnic minority health issues. And so I've been a trustee for the last few years, and so again we're trying to raise awareness of these things, and we've been quite active during COVID.
Thank you. And I know that in the South Asian Heritage Month, if you go to the website, there's a whole calendar of events, and there's quite a few health related ones. So please do have a look. And I'm going to just shout out that we're doing one about South Asians and HIV next Thursday, which we never talk about. So if you're interested, please do join us. I can see a question in the chat, which is from Anthony to Romina. What are some of the recommendations from your research that you can share for continuity of the values?
I could probably answer that question for a whole day, but I think one of the main things is that, and it's kind of in response to one of the previous questions about how do we balance learning about and preserving our culture and still being able to integrate into society. I feel like, in this country, it's, there's been so much pressure to assimilate that the idea of preserving heritage has felt like such a threat to our communities. But actually, what I've experienced, and from our research, what we've learned is that by balancing this dual identity, which is very hard to do, can actually bring out the best of us, in these settings, by knowing ourselves, knowing our history, learning about our heritage, being proud of that. You know yourself in these outside spaces. I feel like I'm in a more equipped position to enter into, predominantly white spaces, know myself and not feel insecure, share my ideas, draw on my heritage to do something creative and different and feel proud of that, talk about my family and really challenge some of the narratives that are said about my community, about Muslims, about Asians. I feel more equipped to do that. So I think, one way that we can take this forward is for the next generation to encourage it, to ask those questions, to ask about their heritage, to learn about people's identity and not see that as a threat, but rather as a way of enhancing ourselves and honoring what we come with. So I'm sorry I can't answer it much more.
May I make a comment, Ragashri? I was going to say that when I was growing up, there was a common force to dichotomize. So, are you British or are you Indian? Or are you, to Romania, are you British or are you Bangladeshi? And of course, there's there's a total loss in that kind of characterization of the complexity, where we're all on a scale. You know, there'll be people within our communities who relate and feel more comfortable at a more British end, and some at the more Indian end, and everything in between, and some. And I think we're living in times where it's much more acceptable to thankfully say that and talk about it, whereas before you had to be one or the other, or neither.
I think you said that so well in your presentation about the Tebet test as well. India, the cricket team were playing at Essex County Cricket Ground, which is in my hometown of Chelmsford, and I went with my parents a couple of years ago, and it was wonderful to be there as someone who identifies as very much from Essex, but also British Indian as well. Just to, you know, I didn't really care who won, which was a fantastic cricket match and great atmosphere. Has anyone else got any questions or comments? Feel free to join in.
Rageshri, I think Nikant had a question. He put it on chat. Nikant, would you like to say something?
I think Romina just she already just addressed my question, which was about how do you balance that, and I think you answered it really well, because that's something that I've noticed quite a lot with the communities that I work with, and I'm first generation, by the way, not second generation. So for me, that's something I think in some ways I feel like I'm more Indian since I moved to Europe about 20 years ago, and I've lived in all sorts of weird places before I even moved to because I've lived in Poland, Cyprus, Czech Republic, and then came here. And I think that experience has probably made me closer to my roots even than when I lived in India, because when I was in India, we were trying to almost not ape the West, but almost mentally be ready for working either in the West or for somebody in the West, because that's where all the big companies that were coming to India. For example, I never spoke any Punjabi when I lived in India. I only picked it up after moving to Cambridge, and it was such a weird thing for my family when I went back and started speaking a bit of Punjabi, and they were really surprised. They're like, you know, we sent you off to Cambridge not to learn Punjabi, but what the hell is wrong with you? That's wasted money. But it's just that how you know, and part of it, I guess, is trying to find yourself, and you only do that when you move out of your comfort zone, and then you realize, and that's when the best of both come in, that you don't have to choose, as you know, I mean, you absolutely said, you don't have to be one or the other. It's on that gray scale that you really start finding yourself, and I think that's really powerful way the way you put that there. So, great presentations, everybody. And Karen, absolutely could not associate more with the maths and science. As I just said in the chat, I remember coming third in class, and my grandfather was convinced I must be adopted. But no, we got over that eventually. But,
Yeah, I agree, Nikant. I think the only two pathways which were shown after my year 10 were either become a doctor or an engineer.
I'm going to say this.
I would also like to say thank you to Alvin and Andrew who are on the call, and it's always nice, like I always say, it's very nice to see leadership getting involved in all these the sessions which we are having for colleagues. Thank you for being part of this.
So I think if there's no more questions, shall we move on, Sangeeta?
So I would like to introduce Raj Pambe, our interim group director, Barts Health. And before joining, she was previously the national lead for engaging and supporting people leaders and HR directors at NHS-E&I. And she's enjoyed a broad and diverse career in public and private sectors, including 3 years as a director in the people and organization practice at PwC. Raj, I would like to invite you to do the closing remarks.
Thank you so much, Sangeeta. And thank you, everybody, for just an amazing hour. I've really, really enjoyed the hour. I think we started this meeting at about 12 o'clock with about 30, and then it increased. And I think we've got, how many of us are on the call now? I think we're up to 36 on the call now. So just a massive thank you. I think to everybody who's taken the time to listen to the stories today, to be a part of, I think, a wonderful celebration. I've been in the NHS for a long time, and I have to say I don't think I've ever been part of anything as rich as what you've created here at Barts Health. You really are a very unique organisation, an anchor organisation. And I just want to pick up, Sangeeta, on your comment about Alwyn. So Alwyn and I had a quick, brief chat, I think, earlier on this week. It's been a long week with our major incident, hasn't it, Alwyn? But we were talking about our roots, and it's amazing how, although we're celebrating South Asian Heritage Month, all of us here today, Alwyn and I were sharing stories about our backgrounds and similar stories. So my family from the Punjab in India emigrated over 100 years ago. Grandfather went to Vancouver in British Columbia, which is where all of my family is, except for my now husband. And my father decided to come to England. So Nikant, just listening to you and the Punjab stories, when I go to Canada, apparently I speak Punjabi with an English accent. And when I lived in Vancouver, I was described as the English girl with the English accent. And people didn't quite know when I'd sit down and sort of describe how strange that felt. And then listening to all the stories you've shared here today, I can remember also being one of two girls that was Indian as I grew up in Southall, and I was born in Hillingdon. She went off to become a doctor. And Karen, listening to you, I read English and sociology. You know, what was that all about, really? And then I went on to do an MSc, leadership in HR, and my mother still doesn't understand what that's really all about as much as I try and explain it. So I've just listened with real fun and humour to all of the stories. But there's also been a serious side of things, I think, today. So listening to Ami and his stories about the science and health inequalities and all of the work that the leadership team are leading here around addressing health inequalities is just absolutely inspiring. And we know we'll look back in 10, 20 years' time with our children and our families just to say we had been part of addressing those fundamental inequalities with people like you, Ami, and other colleagues who are really leading the way around that. And then Romina, as I was listening to you as a sort of clinical psychologist, you know, having read sociology, I had to do a Psych 101 when I was at the University of British Columbia in Vancouver, and thinking, no, I just want to understand about society. But I was forced to understand about psychology, and then thought about nature and nurture. And then coming back, I think, Ragreshi, to your introductory comments, really, today is another opportunity to celebrate, to commemorate, and to educate ourselves and our children on what our parents and our forefathers sacrificed in many ways to give us the lives that we have today and the privileged lives that we exist in today. So I think all the way through to the 17th of August, which is the month that you've created and the second year you're doing this, I think we just ensure that what we have been feeling today, we carry on feeling for both the rest of August, but also into the year. And I couldn't close this session without saying a very big thank you to Tigist and the BAME network, to Sangeeta and Ragreshi for all the work you've done in making today happen. And just to say, just celebrate and continue to be happy, because there's so much richness here and so much to be, as you've all described, be proud of. And I think that's what I felt today, to be proud of this group and this community. So on that note, Sangeeta, I hope I've covered all that I said that I would, but if I haven't, please feel free to come in as the co-host with Ragreshi. Anything else from either of you as the host, because you've just done a fantastic job in making today happen.
Well, thank you very much for your closing remarks, and thank you so much to all of our speakers, everyone who's taken part in the discussion, and everyone who's attended. I want to give a particular thanks to Sangeeta, because it's the second year in which I've worked with her, and she's just been so brilliant to work with. And I think last year we did everything in a rush, and we said this year we'll have much more time, but of course we did everything in a rush because life is busy. And Sangeeta has just been fantastic and calm, so just want to say thanks to Sangeeta in particular.
Thank you, Rajesh. It's always been nice co-hosting this beautiful event, and always great part. I think great participation from the Barts leadership team. Thank you.
Thank you, everyone. We're going to close with some
I'm going to say bye because I have to head off. Just wanted to say thank you very much.
Thank you. I'm going to head off too.
Bye.
Thanks, Rageshri.
Bye, Sangeeta. We'll be in touch.
Bye. Yeah.
Thank you, Veronica.
Thanks,
Thank
Veronica.
you, Tigist.
Tigist, yeah.
Really appreciate it. Thanks.